Live on KETK. Well, especially during the summertime, it seems everyone is always trying to lose weight or maintain their weight.
And joining us to talk more about diet plans is Dr. Katie Root with ETMC First Physicians. How are you?
I'm doing well, thank you. Good morning.
Thanks so much for joining us. So this is really important. I mean, we're going into summer. People want to try and, get healthy, get their diet right. So what do you recommend for people?
Well, the thing we want to avoid is the yo-yo of the dieting where the weight goes up and down, and a lot of people will see these fad diets that promise to make them lose a lot of weight in a short amount of time, and it's easy to fall into that trap, but those aren't really sustainable. And so people will try those, they get frustrated with them, they miss the foods they enjoy, and they end up regaining a lot of weight, and then some usually.
Yeah, so where should people really start if they are trying to adjust their diet then?
Well, what we want to do is find something that's going to be sustainable. We want to start by eliminating some of the processed and the high sugar foods, but we don't want to say, I don't ever want you to eat your favorite food again. We want to everything in moderation. We want a balance.
Yeah.
We want to find a good lifestyle change that they're able to continue on for good.
Yeah, exactly. And so when you mentioned earlier yo-yo dieting, can you give us some examples of this?
Sure. This is probably the most common thing that we see. People say, well, I was able to lose weight with this plan and then I gained it all back and then some. And so really that's where these real restrictive diets come in. Any kind of diet that eliminates an entire food group we want to avoid, because that causes you to lose the weight and then you regain it. And this weight fluctuation has actually been shown to cause increased risk of heart disease and even death in people who have heart disease.
So it's not a good idea to go in and think, I'm going to cut out all carbs or I'm going to cut out all proteins or things like that then?
Right, yeah.
Okay.
We want to have a well-balanced diet. We want to limit things like carbs, but we don't want to just completely cut them out.
Get rid of it.
Yeah, especially people who like carbs. I'm not going to tell you
Like
to eliminate all of your favorite foods.
Bread.
Exactly.
I know, and it's hard. I mean, there's so many of those fad diets, the liquid diets that come out, or any of those specific kinds. So what do you recommend for people in today's world?
Well, sometimes it is good to do a meal replacement for a while, and it's best to have a physician to guide you on this. We can do meal replacements. I wouldn't do a complete meal replacement of every meal, but to do that to lose weight initially, but then you need to be able to transition into a complete meal plan that you're going to be able to do.
Well, and a lot of times I feel like people have maybe like a food diary or journal. Do you think that's a good idea?
It's an excellent idea, yes.
Okay.
I think it really opens people's eyes to what they're eating, because I'll ask my patients, what do you eat in 24 hours? And they'll tell me all the best and healthiest things that they've been eating, but they even forget some of these other things. So it's good to keep a food diary, and everything that you're eating and drinking and sweetening your coffee with and all of these things can add up.
Exactly, and I know there's plenty of apps for that as well. So remind us about an event that you have coming up at ETMC.
Yes, so we have a medical weight management program that's coming up. We're actually going to be starting next month in May, and we're offering several different programs. There's a 6-month program and a 3-month program. It includes visits with myself. We have a dietitian to do one-on-one individual dietitian sessions. We have personal training sessions, and we have a full membership to the Olympic Center included in all of that.
Okay.
So
Awesome.
Great.
Thank you
so much for
Thank you.
joining us.